Hi everyone, I am Dr. Arun Kumar, consultant nephrologist, Century Hospital, Bandara Hills. So, are you suffering from kidney problem? Are you diagnosed to have a CKD, that means chronic kidney disease? So, first thing comes into your mind is my disease reversible? Or is it a progressive disease? Or like, am I one day going on to land on dialysis? These are the doubts that run in your mind when doctor or a medical report says that you are suffering from kidney problem. So to understand what is a kidney problem and is it reversible, so let us discuss. So kidney problems can be of different varieties. So going into detail, it will be a purely medical terminology, like we describe kidney diseases as like a glomerular disease, interstitial disease, and or like is it a renal calcium disease and all. But like keeping these medical terms apart, so basic doubt a patient will have is whether disease is going to be reversed or not. So we generally classify a kidney patient into a stage. So we have 5 stages of kidney disease, stage 1 to stage 5. So stage 1 is a mild form, stage 5 is a last form, severe form. So if you are anywhere between stage 3 to 1, you are in a reversible state. But if you are in from stage 3 to stage 5, that is your stage 4, stage 5, you are in a irreversible state. That means your kidney damage cannot be reversed. But your kidney disease progression can be slowed down if you follow few dietary advices and medications as per doctor's prescription. So if your kidney problem is in a reversible state, we generally look for the reversible cause. So that means what is the reason for your kidney failure or kidney dysfunction? Is it an uncontrolled diabetes, or is it a hypertension, or is it in some underlying heart problem? Are you suffering from any frequent urinary tract infections? Or are you suffering from any frequent dehydration? Or is there any emotional or occupational stress? We look into all these factors. So by looking and studying in detail, we have to individualize the case, and once we come to a conclusion that these are the risk factors or these are the precipitating factors that this patient is suffering from. So after identification of those factors, we can reverse the kidney disease by individually addressing each and every factor responsible for it. For example, if a patient is having kidney stones, we attend for the kidney stones, we give proper dietary advice and fluid management and medication so that recurrent stones can be prevented, and this can eventually decrease the stress on the kidney. If, for example, patient is having uncontrolled hypertension, we have to immediately attend by titrating the doses of the BP medication. Similarly, diabetes. Diabetes is one of the predominant cause today that not only India, whole world is facing. And most of the kidney patients, it is the predominant cause for them to land into a end-stage renal disease or sometimes even into on dialysis. So check your sugars properly and consult a physician and get them corrected as early as possible. So if you are able to correct these factors, then yes, definitely your kidney problem can be reversed. And now what can we do to prevent the progression? If suppose patient is identified in stage 4, yes, even now your kidney disease progression can be slowed down by again correcting your sugar, BP medication, and correcting your hemoglobin levels. You have to check your vitamin D, calcium and other vitamins, and you have to correct them. And if you are not vaccinated, go and take vaccine. Not only corona, but also take pneumococcal vaccine, hepatitis B vaccine, because any infection can trigger your kidneys into, or they can push your kidneys into end stage. So you drink adequate amount of water as much required by your body and prevent infections, and take vaccination and check your cholesterol levels, keep cholesterol levels under control, and if you are having any cardiac problem, consult a cardiologist and use the medication regularly, and don't take too much non-vegetarian food, because high protein diet itself can cause harmful effects on the kidney. So restrict your protein intake to less than 1 gram per kg body weight, and animal versus vegetarian diet proteins. So we have very clear-cut evidence that vegetarian protein like your pulses, soya bean and all, they are not going to cause any harm. It is the red meat or animal protein that is going to cause filtration pressure or pressure on your kidneys, and that can eventually lead to progression of kidney disease. So avoid animal diet, animal protein diet. So these are the dietary advice. And of course, cool drinks. So they contain lots of amount of phosphorus, and this is again not good for your kidneys. So by controlling these diets and avoiding few habits like smoking and alcohol, you can delay the progression of kidney disease. And today we have also other medications which when you consult a nephrologist you can prescribe you, and those we have clear-cut data that they can prevent the progression of disease. So even though you are diagnosed to have a kidney problem, don't worry, we can still slow the progression of disease, as well as if you are in stage 2 or stage 3, we can get back you into normal life.